I'm Dr. Lisa with Private Practice Made Easy, Your Turn to Lead. And in this video, I'm going to talk about one of my products that I use in my private practice, which is TMS, Transcranial Magnetic Stimulation. Came across this YouTube video and I wanted to share it with you. It's CBS this morning that talks about TMS, and it's just a great explanation about TMS. And then it goes into a story about how TMS helped this woman with medication resistance. She had tried 5 different medications. And the thing about TMS is that a lot of people don't know about it. So I'm really trying to spread the word because only 5% of people even know what TMS is. So let's get into this video. I think it's really informational and educational.
Some psychiatrists now recommend alternative uses magnetic pulses to stimulate neurons in the brain. Jamie Yuka spoke to a woman who has tried this treatment. Jamie, this approach sounds a little daunting. What's behind it?
Well, Gail, antidepressant medications and psychotherapy are, of course, the first-line treatments for major depression. These treatments, however, do not always work for everyone. In some instances, this treatment that you're talking about, called deep transcranial magnetic stimulation, might be used as an alternative or in combination with medication as a therapy.
Depression is the greatest thief ever. It robs you of your life, your happiness, your joy.
Marcia Terry has lived with depression for most of her life. At her lowest point last year, she says she was unable to leave her apartment for months.
And I thought, there's no hope. I might as well just get used to it. I'll do the bare minimum of what I have to do in life. Otherwise, I am just going to sit in my chair, do nothing, watch TV.
Terry tried 5 different antidepressants without success. Her husband finally convinced her to meet with a psychiatrist, offering a treatment called deep transcranial magnetic stimulation, or deep TMS.
Then I'm going to tighten it so it should feel a little bit more snug.
Okay. When the person has depression, a certain area of their brain is underactive.
Dr. Aaron Tendler is the chief medical officer for Brainsway. The company's device uses magnetic pulses to create electrical activity and stimulate the areas in the brain that don't fire normally in people with depression.
I would say after the first week, I was for sure sleeping better.
So within the first week of treatment, you saw improvement?
Yes.
Patients undergo 20-minute treatments 5 days a week for an average of 6 weeks.
They can drive, they can go to work. It's highly effective and low risk.
And Terry says these days she's feeling an unfamiliar but welcome emotion, joy.
It's weird. I started noticing things around me more. One thing recently that happened about a week ago, we were walking home, and I, out of the blue, popped into my head and I said, I love life. I've never said that in my life before.
You've never said that before?
Never said it before.
Dr. Steven Siegel is head of psychiatry at Keck School of Medicine at the University of Southern California.
It turns out there is nothing we have that's perfect for everyone.
He says the daily sessions can be time-consuming and prohibitive, and the treatment can be extremely expensive if not covered by insurance.
I think it's important people know that TMS is only one of the options available. We have talk therapy, which is very effective. We have medications, which are very effective.
Ready? Jump.
Even after receiving deep TMS, patients may still experience depressive episodes and need further treatment.
It works so well the first time that if you go through another bout of depression, you'll go back.
Oh, 100%. I will be on that phone so fast. I will never give up again. And I have so much hope.
The device is FDA cleared, but some experts say there is not enough research on who this will help and its long-term effectiveness. They say deep TMS is not for everyone and that people experiencing depression should work with their healthcare provider to find the solution that's best for them, Tony.
Yeah, not for everyone, but hope is the word.
Yeah, so I thought this video was really good because it talked about one of the treatments that we don't talk about enough, TMS. And then it's just one mode of treatment. Medications help a lot of people, and some people that even take medications, it's just partially they're responsive to. So TMS might be an adjunct or additive to their treatment plan. And of course, therapy. So I think there's no one fits all approach. You just have to customize your treatment based on the patient's response. So hope you found this helpful. Again, it's a product that I use in my psychiatric practice, Turning Point Psychiatry.